Good day, everyone. We are Group B2 and we will be discussing fractures, including their causes, types, affected structures and function, complication, treatment and management, and the bone healing or repair process. A fracture is a break in the bone that can be complete or partial, depending on the type and extent. Fractures happen when the bone experiences more stress than it can handle, often affecting nearby tissues and causing swelling, bleeding, dislocation, tendon injuries, nerve damage, and blood vessel harm.
Healthy bones are strong and resilient, able to handle a lot of impact, but with enough force, even strong bones can crack or break. Main causes of bone fractures. Physical trauma. Direct blows, a strong impact like being hit can break a bone. Crushing forces. Heavy pressure or crushing can lead to fracture. Overuse. Extreme muscle contraction. Over time, intense muscle strain can stress bones enough to cause fracture. Health conditions. Osteoporosis. This condition weakens bone, making them more likely to break. Aging. As we age, our bones naturally get weaker, increase the risk of fractures. Sudden movements. Twisting motion. A sudden twist or turn can fracture a bone if the force is too great. Understanding this risk can help us to take a better care of our bones, especially as we age.
Fractures can vary greatly depending on how the bone breaks. Here are some common types, including transverse, oblique, spiral, comminuted, impacted, brain stick, open compound, closed simple fractures. Number 1. Transverse. This type of fracture runs horizontally perpendicular to your bone, opposite the direction of your bone. This means the line of the break goes all the way through your bone. Number 2. Oblique. This happens when one of your bone is broken at an angle. This means the line of the break goes all the way through your bone. Number 3. Spiral. This happens when one of your bones is broken with a twisting motion. They create a fracture line that wraps around your bone and looks like a corkscrew. Number 4. Comminuted. These bones are shattered into small pieces. These fractures can affect any large or long bone in your body. Number 5. Impacted. Occurs when the force of the injury jams together the broken ends of the bone, in which the broken ends of the bone are shattered into many pieces. Number 6. Green stick. A fracture in a young, soft bone in which the bone bends and breaks on the one side only, not through the bone. Number 7. Open or compound. The broken bone juts out through the skin or a wound leads to the fracture site. And lastly, closed or simple, a type of broken bone that has not pierced the skin.
Next is the structures and function affected. As for the structures affected, bones can suffer from fractures which range from minor cracks to severe breaks. Dislocation or subluxation may occur when bones in joints become separated. Next is the ligaments. This can be torn, resulting in sprain. Muscle. Tearing of muscle leads to strain. Tendons can be torn, causing ruptures. Surrounding tissues such as skin, nerves, blood vessels, muscle, and organ may be damaged by fractures. As for the functions affected, movement, dislocation, strain, sprain, and rupture can all impair joint and muscle function, reducing mobility. Stability. Ligaments and tendon injuries can affect the stability of joints and bones. Protection. Damage to muscle and other tissue can impair their ability to protect underlying bones and organs. Circulation and nerve function. Injuries to blood vessels and nerve can impact blood flow and nerve signaling, leading to further complication.
Fractures can lead to various complications based on their timing. There are three categories of fracture complications: immediate, early, and late complications. In immediate complications, these occur at or shortly after the injury. These include damage of blood vessels, leading to bleeding or hematoma, nerve damage, resulting to sensory and motor deficits, and fat embolism, causing respiratory distress. Early complications. These arise within days to weeks after the fracture, and this involves compartment syndrome, increased pressure affecting muscles and nerves, pulmonary embolism, blood clot traveling to the lungs, and infection, from open fractures or surgery. Late complications. These develop weeks to months post-fracture and include uneven limb length, issues with healing, such as non-union and malunion, joint problems like stiffness or arthritis, and osteonecrosis, bone death due to disrupted blood supply. Effective management of these complications is essential for optimal recovery and function.
Next is the treatment and management of fractures. The treatment of fractures depend on its type, cost, and the extent of bone damage. Immobilization. Mild fracture. If bones are aligned, a splint or cast is used to immobilize the fracture. Splints are worn for 3 to 5 weeks and cast for 6 to 8 weeks. Regular x-rays monitor healing. Close reduction. Severe fracture. For misaligned bones, a non-surgical procedure called close reduction is performed to realign the bones. This may involve the local anesthesia, sedative, or general anesthesia. The bone is then immobilized with a splint or a cast. Surgical option. Internal fixation. For severely damaged bones, surgery is performed to realign and secure the bone using metal rods, plates, screws, or pins. Some hardware is permanent while others may be removed later. External fixation. Screws are placed in the bone and attached to an external brace to temporarily stabilize the fractures before more permanent fixation. Arthroplasty or joint replacement. If a joint is fractured, it may be replaced with an artificial joint made of metal, ceramic, or plastic to restore function. Bone grafting. For fractures that are severely displaced or slow to heal, bone grafts from the patient and donor or an artificial substitute are added to aid healing. Internal fixation may also be used to secure the bone. Post-surgical care. After any surgical procedure, immobilization with a splint, cast, brace, or sling is necessary to protect the bone during healing and support recovery.
The bone healing process involves 3 phases. First is the inflammatory phase. Right after the injury, blood vessels break and form a clot called a fracture hematoma. This disrupts blood flows and causes some bone cells to die. This phase lasts about 1 week. Next is the repairing phase. A few days after the injury, new cartilage and tissue form at the fracture site, creating a soft callus that stabilizes the broken bones. Over the next few weeks, this soft callus is replaced by a bony callus made of spongy bone. Finally, the remodeling phase begins. Solid bones replace a spongy bone. The outer surface might stay a bit swollen for a while, but this usually revolves on its own.